All right, we'll go ahead and get started. Thank you all for being here for the Monday media availability. On the docket today, we'll have James English, who is in charge of COVID-19 operations for the incident management team for COVID-19. And we'll also have an update after Jim with Melody Osborne, Chief Nursing and Quality Officer of the Health Services Division at Renown. And after that, we'll do Q&A for both people. So Jim, or sorry, I'll call you James. I'll try and stay consistent. If you're ready, please go ahead.
Good morning, everyone. Hope everyone had a great weekend. So today we walk into our weekly pod situation with 925 first doses on hand. We received 3,475. Second doses on hand, we have 2,752, of which 1,170 we're keeping in reserve for rural Nevada and for any other partners that need assistance. That is all Pfizer vaccine that's in reserve. We have about 1,582 scheduled second doses between today and tomorrow. And by the end of today, we should have vaccinated over 9,000 people here at the Washoe County Health District pod in second doses. First dose pods we're running on Wednesday, Thursday, and Saturday. And then next week, we have also scheduled first dose pods for Monday, Tuesday. We have a total of 4,350 first dose vaccinations scheduled for the next through next Tuesday, of which we received 4,000 doses of vaccine to cover that with our additional on hand. So we have plenty of vaccine to cover that. We also continue to see no-shows for both first and second doses, which allows us to try to fully utilize our schedule. To date, we're 86% of our vaccine is getting into arms within a week. Friday, we vaccinated 1,811, and Saturday, we vaccinated 1,270. So we had a great weekend. Those were school district closed pods on Friday and Saturday, along with some final child cares. Based on that, we are moving into community frontline support. And the one message I want to go ahead and give this group is that if you believe you're a business or you're an agency that thinks that you fall into the community support frontline and you provide services, please go to our website and register your organization or your business or your agency. We will go ahead and vet those and begin to schedule your groups. So we are currently going into that group, scheduling those that essentially are first working with the underserved populations, providing the necessities of life. We will have our last school district closed pod this Saturday. We do not expect it to be filled, and we will be filling the remainder of slots off our waiting list of our seniors at 70 plus. So randomly, we will be pulling a list from the 70 plus group to fill those slots this upcoming Saturday. We also continue to work with various partners on the equity issues and to try to serve the underserved seniors within our population that can't get through on the internet or through the online scheduling systems. One group we're working with is access to healthcare. We think that will help. And we are also looking at creating two lists, pulling two different lists from our waiting list, one that do not have emails and one that do, so that we can try to ensure those that don't have access to computers right now can make sure they can be vaccinated. With that, I am done with my update for today.
All right. Thank you, James. Appreciate that. We'll go to Melody Osborne. If you're ready to give your update for Renown, please go ahead.
Yes, good morning and happy Monday. So on January 14th, we began vaccinating the general public aged 70 and older. And to date, Renown has completed nearly 24,000 vaccines. And this includes our Tier 1 medical staff members, our Renown Health employees, students, volunteers, and seniors in our community. Just this past week, we completed approximately 3,600 vaccines. The weather has not stopped us, and our Renown vaccine clinics continue despite the winter weather. I really want to take a moment to sincerely thank each of our 600 renowned employees, physicians, and our battle-born volunteers who have stepped up to offer their time at our numerous vaccine events that we have hosted over the past several weeks. As we look to the future to create a more sustainable model to continue to vaccinate our community, we are in the process of hiring temporary staff to fill these volunteer roles that our generous volunteers have been helping with. So based on weekly staffing as well as vaccine allocations, we are looking to increase the number of our vaccines that we are currently providing. And as we've talked about before, all of those who are eligible 70 and older who have a renowned MyChart account and have received that ticket to schedule are already on the waiting list. We just ask for the community's patience as there are a significant number of community members already on that waiting list. And with the limitation in the vaccine supplies, we are working to get to those folks on the waiting list as quickly as possible. There will be a link to our covidrenown.org website that Stacy would be happy to include on our team chat here today. And that's my update. Thank you.
All right, thank you, Melody, for that. We'll open it up to a Q&A for James English from the Health District and Melody Osborne from Renown. So if you have questions, please shout them out or leave them in the chat and I can read them out.
Hey guys.
Hi.
Oh, sorry. Go ahead. Oh, hey.
Sorry, Tony. Hey, Dr. English, just wondering, so from here we go to the state and local government folks, is that correct?
We actually go to some of the state and local government folks, those that serve the frontline services. So Health and Human Services Agency, we're going to start seeing some of the court staff come through, some of the public defenders and alternative sentencing. We're also going to see all those that work with the homeless population in the government sector. But what you're really going to see right now is a large number of the nonprofits and agencies providing services to a multitude of different groups in our community start getting the invite to vaccinate, whether they're providing meals, whether they're helping those with disabilities, they're therapists. Those sort of individuals and agencies are starting to be invited right now. All the such as the Red Cross, the food banks, all those groups have received an invite at this current time. So it's all those frontline individuals that work with our community to ensure that everyone can live their life to their fullest capacity.
And about how many seniors are still on that waiting list, would you estimate?
That's a really hard number to tell because when I asked Scott earlier today, it was close to 50,000. But what we're finding is that people continue to just sign up over and over again. So we have to weed out all those duplicates. And it looks like everyone's on there about 2.5 times. So we don't have that exact number. It's probably closer to around 30,000. But I think as more people get vaccinated, they're not contacting us that they have been. So we have asked that they call our call center or email us so they can be removed from the list. But I would fully expect over the next few weeks, you're going to see that number go in the downward direction for the first time.
If you had to estimate how many, how quickly do you think you guys, and with partnerships with other pharmacies and hospitals, how quickly do you think those seniors will get vaccinated?
I can't fully answer that question because most of the pharmacy partnerships are at the federal level. So what you saw get pushed out at the end of last week at the federal level, that was a federal program to those pharmacies. We don't get their numbers. We know that part of the state program, there's about 1,800 vaccinations coming to our region through the pharmacy partners the state has signed up. So I'm hoping that in the next week or so, more than 1,000 seniors will come through our location based on some fill-ins on these closed pods now that we are at the point of completing the school district and the Nevada higher education system.
And then one thing I would add to that, Kenzie, Jim's right. It's right about 40,000 is what we think the list has. But also if people have already received the vaccine and need to get off any type of waiting list, For the Washoe County one, we want them to call 328-2427, which is our general COVID hotline, or email covidvaccine@washoecounty.us.
When it comes to vaccines, how come experts are now just warning people not to take painkillers before or after getting the vaccine?
Melody or Jim, do either of you have expertise to answer that question?
So I know that our guidance here at the health district has always been not to have any pain medication prior to a vaccine so that you can fully understand whether or not you have a true side effect. That's always been our guidance, and we've been highlighting that. I think now that more of the country is receiving second doses, it's being highlighted more due to side effects.
What should people do once they get that, say, that second dose, which is a lot of experts are saying that that's when you experience more of the severe symptoms, but what do they do if they are experiencing that? What can they take?
I don't have the expertise to go ahead and answer that question. We do have a flyer we're giving to all the individuals getting vaccinations here on what they should expect to experience in the way of side effects. And if it's outside of the normal side effects, to call 911 or their primary care doctor. At the same time, that's why we also encourage everyone to stay in our 15 or 30-minute lot. And we do have paramedics on scene. And sometimes we also have MRC volunteer doctors to assist anyone with any questions.
James,
Is the health district expecting dosages of Johnson & Johnson in the coming days?
We have not been given any guidance on how Johnson & Johnson will roll out to our region. I can tell you from a planning and logistical standpoint, I have told the state that we will continue to operate Moderna and Pfizer because there's much more stringent handling requirements, and that we would be happy to have that go to our smaller providers here in the region where it's just has to be refrigerated and they can go ahead and push it out to our community much faster. We don't see the supply chain being as robust for Johnson & Johnson. I do know that a lot of our small providers have already requested that, so we will go ahead and support that since we have the infrastructure to run both Pfizer and Moderna.
How's the overall reaction or response to people getting the vaccine? Are they feeling ill? Is it just soreness in the arms? What's the kind of the general consensus when you talk to people, James?
It's really all over the place. So just about everyone has a sore arm. We'd suggest you continue to keep that arm moving all day long after the vaccination, to low-grade fevers, to aches and pains. And we have had some allergic reactions here and I've heard of those afterwards, but it's across the board. And we do recommend, as employers start scheduling their staff, since we're continuing to go farther down in the lane, that they do work with their scheduling to ensure that they have proper staffing in case anyone does need to take the day off because they are either tired or having some side effects from the vaccination.
Are you seeing that more people react maybe severely to the first shot or the second shot?
On our Washoe County Health District providers calls with the various physicians in the community, we're hearing that you have more side effects to the second dose. I definitely had more side effects to the second dose, and frontline health district staff that have been out working at the pod and our vaccinators also seem to have experienced that.
That 15-minute to 30-minute lot that you guys have at the Livestock Event Center, is that kind of like the time range that you guys have seen that's usually somebody will react to it? Is that standard for all vaccines or that specifically for the COVID-19 vaccine?
That guidance was specific to the approvals of the COVID-19 vaccines. So we are following the CDC guidance and the best practices for administering it. They set those standards. So our nurses at screening review those questionnaires we ask everyone to fill out ahead of time. And based on the answers there, they determine whether or not they can be, people should be in the 15-minute lot or possibly wait in the 30-minute lot.
Thanks, James.
I see a couple people with their hands up. Jason and Valentina, please go ahead. One of you two.
Yeah, James, you mentioned that you guys continue to work on with partners on equity issues, and of course, the governor made it a focus last week. Obviously, as far as vaccine allocation, most of it is going to go to frontline workers and what have you. But as far as the data you're seeing for just the general public, like the seniors, are you noticing any trends at all as far as like equity or like which communities are like getting like higher percentages of people getting shots?
I actually haven't seen a lot of that data. The data we have seen from the state is more than a week old, and I think more and more seniors and general populations have been vaccinated since then. But Community Health Alliance is doing community-wide pods, and so is Renown, so they might have a better answer. Maybe Melody would have a better answer on what they're seeing. But here, since we're concentrating on the essential workforce, we're seeing our demographics kind of align with the individuals that are actually employed in those fields.
Yeah, so just to respond to that question, we are looking at our demographic data. Unfortunately, I have not seen that data probably in the last week and a half. So we can certainly bring some additional information to our next update on Thursday, because I think that's a really important question.
Thank you.
Hey, if someone has had a COVID plasma transfusion, can they get the vaccine, or they have to wait a month or 90 days to get the vaccine?
James or Melody, is that a question you guys know the answer to, or do I need to track that down?
I'd go ahead and track that down. I know that's on our questionnaire. I don't have in front of me.
Just one more about the COVID plasma. Can you still donate COVID plasma if you had the vaccine, or now you can no longer do that?
That'd be another one for you, Scott, to follow up on.
Valentina, if you just want to send me an email, I'll track that down.
Sure. And just to make sure I understand this right, so taking a Tylenol when you are taking the vaccine, that doesn't lower the power of the vaccine, right?
No, the recommendation is that you don't take any pain relievers prior to getting the vaccination. So you want to know whether or not you're truly having a reaction that may or may not need medical care. So the pain relievers are not going to affect how the vaccine works in your system or reduce its efficacy.
I have one more question. In Colorado, they're giving the second dose of the vaccine as the first dose, so more people get the vaccine faster. And if they don't backstock those first doses, which they're trusting they will start giving the second dose as the first dose. Is Washoe County planning on doing anything like that just to get more people vaccinated?
Currently, right now, we're going to follow the CDC guidance and the state guidance, which is to use all first doses for first doses. We are seeing our numbers of vaccine continue to increase. I've heard we might get an additional 20% show up next week. We have gotten a steady flow of second doses, so we have no intentions to change our current strategy. The way it lines out, we think that getting people vaccinated with both doses as quickly as possible is best. So the key there is we're still seeing a tremendous number of individuals reschedule their second doses. One day last week, we had over 100 additional people on one of our second dose clinics because of rescheduling. So it's really imperative that when people schedule their first dose, they know 21 or 28 days later that they are free to come back for that second dose. So we will continue to use first doses as first doses. We do not have an excess of first or second doses. And based on the efficacy and the science out there, it makes the most sense to follow the CDC's guidance in the state playbook.
And how is the county making sure the vaccine is reaching different geographic areas within the county for people who cannot leave their homes, or they just don't physically cannot leave their homes? How you're making sure the vaccine is getting to those people?
We actually have a full homebound vaccination process, which we have actually increased to 3 days a week. So we can do a minimum of 18 vaccinations to homebound individuals. And we're working in conjunction with geriatric specialty care, Reno Housing Authority, and the other medical providers to find out who truly is homebound and can't leave their houses. We are looking at that geographically to figure out the best route to go ahead and vaccinate individuals, and we will be working in various areas of the community every single week. The big logistical hurdle there is the fact that you have to stay at least 15 minutes at every individual's home while you wait to ensure they don't have a reaction. So we have partnered with REMSA, and we send one of our nurses with a paramedic to each one of these locations. The first house is where we actually mix the Pfizer vaccine, and then we draw that first dose. After that, it has to stay at room temperature, and we have to administer the next 5 doses within 5 hours. So we seem to have the best setup right now for that, and we are continuing to try to improve that and get as many vaccinations as possible to homebound individuals.
So if I'm at home watching this, how do I get in touch? How do I let you know I'm one of those people?
Go ahead and call our call center at 328-2427 and let our call center know you're homebound, and we will add you to the list. Your doctors' offices and primary care physicians should also be reaching out to you to let you know that we have this process.
Thank you.
Any other questions for James or Melody?
Yeah, James, you had mentioned the last the pod for the district this weekend. Do you know how much of the district opted to get the vaccine? How many have been vaccinated?
No, actually we don't. That would all be HIPAA information that's protected. We know that the school district has pushed it out to everyone that's currently employed by them. They are doing a final blast out today, and we should have some pretty solid numbers tomorrow of what we expect to see coming through in the school district. There are individuals that have since decided they want the vaccine, but right now I could not tell you that, nor would I expect the school district to be able to tell you that. We are seeing a lot of people trying to tell us that they are substitute teachers with Washington County School District and therefore need the vaccine, but you do have to demonstrate you're currently employed by the Washington County School District as a substitute teacher. So anyone that used to be a substitute teacher that has been on the fence whether or not they want to continue or go back to being a substitute teacher, you may want to start with the Washington County School District there and sign back up and get re-engaged, and then you'd qualify for a vaccination.
Any other questions for James or Melody? All right, hearing none. Thank you both for being here, and thank you all to our to media for being here as well. This is recorded. It'll be on our COVID19washoe.com website under press conferences. So if you have any other further questions, feel free to reach out via email is best. We will have Kevin Dick on for Wednesday's media briefing, and then I'll have more information about who's on Thursday at that Wednesday briefing. So thank you again for being here, and I'll talk to you soon.
Thank you.
Thanks, Scott.